We live in a world where we have instant access to the lives of other people. Times have changed since the days of waiting for a specific time to watch a celebrity on TV or catch their latest ad. Now social media allows us to see what they're wearing, saying, endorsing, and look like at any moment. As Theodore Roosevelt once said,
"Comparison is the thief of joy."
And in today's media-driven world, this comparison is constant and often overwhelming. Filters, editing, and lighting create an idealized version of beauty that is often unrealistic and fails to embrace the diverse range of shapes, colors, and sizes that make us who we are. This narrow standard can lead to deeper issues, such as body dysmorphic disorder, BDD, as people try to meet an unattainable goal. Let's get into this a bit more. While the media we consume and the people we admire can influence the severity of body dysmorphia, it is not the root cause. Body dysmorphia is a complex disorder with multiple contributing factors. While genetics play a role, accounting for up to 50% of cases, trauma, bullying, or abuse can also increase the risk. Social media usage is another key factor, as spending time on platforms that focus on appearance can trigger comparisons and worsen symptoms. These combined influences may increase the likelihood of developing BDD, but they do not guarantee it. Most cases of BDD develop before the age of 18, typically developing around age 12. The rates of BDD are relatively high, affecting 2 to 3% of the general population, similar to the prevalence rates of conditions like psoriasis. BDD, however, often goes unrecognized. There is not one clear causative factor for this condition, but there are several factors that increase one's risk. While everyone experiences some level of self-doubt, BDD is different because it becomes all-consuming, affecting daily life and leading to harmful behaviors. It's important to understand that when someone with BDD looks in the mirror, they do not see the same thing you do when you look at them. Instead, because of their condition, they fixate on one or more flaws in their appearance that starts to consume their thoughts and affect how they go about their everyday life. One of the common misconceptions about body dysmorphia is that it's primarily about weight. BDD, however, goes beyond body weight. Some of the most common concerns that these patients have with their bodies are related to their skin, hair, nose, genitals, breasts, teeth, and even voice. It's not just about weight, and it's not just about wanting to look different. It's a mental health condition that can affect daily life, school, work, relationships. Some people even go through risky procedures or excessive grooming, but no matter what they do, they're never fully satisfied. Despite stereotypes surrounding male appearance concerns, which often lead to BDD being overlooked in men, it affects both women and men. One subtype of BDD that is more common in males is called muscle dysmorphia. A study found that it affects up to 6% of young adult males. This is where the person becomes preoccupied with their muscle mass. Unfortunately, the use of dangerous substances like anabolic steroids is substantially higher in this population, often leading to a host of physical and psychological issues. It's important to note that individuals with gender dysphoria, including those that are transgender or non-binary, may experience symptoms similar to body dysmorphia due to a mismatch between their physical traits and gender identity. However, this is different from body dysmorphic disorder and requires a distinct approach to treatment. Recognizing the difference is crucial for providing appropriate care. Like many mental health conditions, body dysmorphic disorder can involve relapses throughout a person's life. However, it is important to emphasize that with the right treatment, BDD can be effectively managed. Research shows that a combination of therapy and, in some cases, medication can lead to significant improvement in symptoms, often within 8 to 12 weeks of starting treatment. The primary treatment for BDD include medication and therapy, specifically cognitive behavioral therapy, CBT, which focuses on addressing perceived appearance flaws and the fixation with them. Medications, particularly selective serotonin reuptake inhibitors, SSRIs, are also effective in treating BDD symptoms, as they help reduce obsessional thoughts, compulsive behaviors, and distress. Every individual's experience with BDD is unique. Fortunately, Horizon's addiction and mental health teams in New Brunswick offer a multidisciplinary approach to treating individuals with persistent mental health conditions. Our team can help guide New Brunswickers to the right care, connecting you with the appropriate clinicians and services. Living with body dysmorphic disorder can feel isolating, but it's important to remember that your feelings are valid. You are not alone, and help is available to those who seek it. With the right support and treatment, healing is possible, and you can regain control over your life and well-being. It's never too late to seek the support you deserve.